Hi, my name is Tim Bale and I'm co-director of the Myelin Institute at Queen Mary University of London. Welcome to another in our series of videos on global health and the pandemic. Today we are going to hear my QMUL colleague Dr Jonathan Kennedy talking to Dr Talya Greene of the University of Haifa and also attached at the moment to UCL about how both patients and staff and those of us in lockdown are coping with the mental health challenges posed by COVID-19. They're going to be talking about some of the extreme stresses that people feel and also about how people can be helped and how they can help themselves, and also the longer term consequences of what we're all going through. If you enjoyed this video, please do share it, please do subscribe to our YouTube channel, and please do come back for more.
Good afternoon, Dr. Talya Greene, and thank you so much for joining us. So we're really lucky to have Talia here to talk to us today about the impact of COVID-19 on mental health and trauma. So Dr. Greene is a senior lecturer at the Community Mental Health Department at the University of Haifa. Dr. Greene's currently working with the COVID Trauma Response Working Group, which is a collaboration between UCL and various NHS trusts. So thank you so much for joining us this afternoon. So it's kind of the middle of May now. It's about 5 months since we first heard about this disease, COVID-19. It's about 2 months into the lockdown, and I think it's been pretty tough on everybody. We've had to stay mainly at home. We've been bombarded with these really quite disturbing pictures from hospitals. We've been bombarded with kind of bad news about the economy and all sorts of other things, statistics about deaths and cases. It's just, we've been inundated with bad news. And I was just wondering if you could talk a bit about the link between COVID and trauma that you've seen in your own work.
The first thing to say is there's lots of potentially traumatic events that are taking place and people are being exposed to all kinds of difficult things. And we've identified a number of different groups that we can see as being at risk. And I should say at particular risk because obviously we're all exposed to these COVID traumatic stressors, but there are some particularly high risk groups. So as you mentioned, I think, and quite obviously to everyone, healthcare workers, people working at the front line, obviously at risk both of their own direct exposure to the trauma and also because they're really working with and seeing an awful lot of distress amongst patients and higher rates of death and difficult conditions that they're not used to working in. So of course they are a high risk group, and I include within that also social care staff. Obviously we've heard on the news a lot about care homes and how care homes are now have very high rates of illness and of death. And again, I think care home staff are in many ways exposed to those same stresses as healthcare staff, but perhaps are in some ways even more vulnerable because they get less recognition for the most part, and typically I think their work is not highly valued and certainly not as highly valued as it ought to be. So that's one group that I think are at risk. There are also obviously people who are surviving COVID. So people who've had the illness and either been in hospital or at home. But I think particularly those who've been through intensive care, we know that intensive care generally poses risks for trauma and PTSD. And I think this might be even more so in the current case. So that's another group. But I think there are other groups that perhaps have had slightly less attention but are worth thinking about. So people who've been traumatized in the past have their own experiences of perhaps unconnected to the current situation, but trauma nonetheless, and might also have PTSD, and they're vulnerable to being re-traumatized in the current situation. And there's also a group, I think, who are at risk not from direct trauma from COVID, but actually more from the risks associated with lockdown. So people who live in unsafe situations, who are living with abuse, who are living with high rates of poverty, extreme poverty, for those people, lockdown itself poses potential for trauma. And I think there's one last group that's worth mentioning is the group of people who are traumatized, who are bereaved during this process. And obviously people who are bereaved from COVID, but also people who are bereaved not from COVID, but are suffering a loss at this time, and they aren't able to go through the normal mourning processes that we normally have available to us. So people aren't able to have funerals in the same way they might have done. They're not able to access that face-to-face support in the ways they would normally do so. And so I think for all of those groups, they have particular risks from psychological trauma, and also particular risks from developing post-traumatic stress disorder or depression or anxiety or other long-term trauma-related reactions.
Thanks, Talia. That's really, really interesting, but also really concerning. And it's remarkable how, you know, the number of cases and the number of deaths from COVID-19, we can just see that as the tip of the iceberg, really, with regards to the health effects of COVID-19. And as you really comprehensively described, there's all these other groups that suffer these really, really kind of very negative effects on their mental health. I'm just wondering what can be done to help these people.
So I think first of all, it's very important to know that things can be done, and it's not obvious. I think sometimes people assume that bad things happen and then the negative impacts of those bad things are inevitable. And I don't believe that they are inevitable. I think that first of all, at this early stage, just making sure that people are okay at the very basic level. So if, for example, talking about healthcare staff, just reducing the real threat, the real objective threat to them by providing safety equipment, that in itself can be protective, not only obviously for physical health, but actually for mental health in both the short and long term. I think understanding that there are particularly vulnerable groups, and so when we talk about vulnerability, obviously we're talking about mental health, but again, we're talking about basic needs. Are they scared for not being able to access food? Are they really at risk at a very basic level of extreme poverty? These are things that we need to think about at this kind of immediate and very basic level. Beyond that, we know that having social support is important. So for those who might struggle to access social support, and again, we're talking about social support in a kind of physical distancing, world and paradigm. So we're not talking about people visiting the house necessarily, but we're more talking about, do people have access to technology? Can they have a phone? Can they use the phones? Can they have video calls? Are these things that are available to people? And I think also equity is very important to mention at this point, that there are obviously some people that have access to these things on a routine basis, but thinking about, again, those more vulnerable groups, do they have that same level of access to the technology in order to facilitate that contact? So I think that's just really at the very basic level. I think at a slightly kind of stepped up level, we do need to make sure that there are resources available for traumatic stress services. At the moment, there's been a lot of redeployment of staff from one group to another. So in some cases, staff from traumatic stress clinics and services have been redeployed to provide support for those people in the hospitals or the healthcare system that are needing to access extra support. And it's good that the healthcare staff and other people can access that support, but it does raise questions about what happens to people who don't have access to their routine services. And obviously they are, again, still vulnerable and require that ongoing mental health support. So I think that it's very clear that we now need to think about increasing the allocation of resources and provide, so that we'll be able to provide that kind of stepped up requirement of care to more people.
That's great. That's really fascinating as well. And my background's much more politics and policy, and it's fascinating from what you're saying about how it seems like COVID-19 is really demonstrating some of these latent problems in society with inequality, with cutting back in social services, and this is really having a negative effect on certain parts of the population. So that's absolutely fascinating. Obviously, I talk to some of my friends and family and colleagues, and they're really suffering, and certainly I really kind of can see in what you're saying that it's very much true. But then I talk to other people, and they seem to be, in a strange way, kind of enjoying isn't the right word, but they're saying that in many ways the kind of COVID-19 pandemic has had a positive effect on their mental health. And sometimes it's just people with children and families that are happy to spend more time with their families. Sometimes it's people working for the NHS who feel like for the first time in years and years, they're actually appreciated as workers. And I just wonder if you could speak to that. Is that just, are these just anomalies, or are we seeing something else?
No, I think that I think you bring up something very important and true, that people are different from each other, and that these kinds of reactions will be quite individual. They'll be very specific to people's existing circumstances, and they'll be specific to the kind of exposures or experiences they're having during this time. So it's made up of these two kind of aspects of what you already have. We call this the kind of psychological and material resources that people have, as well as what happens to them at this point. And I think that actually, for the most part, people are resilient. So if we look across the population, we'll probably find that most people, while not necessarily enjoying this time, will emerge, after COVID, that they'll be okay. Maybe it was difficult, maybe it was stressful, but basically they will be okay. And maybe they will even look back on it and say, actually, as a result of this experience, I became closer to my family and I learned what was important. And they'll experience something that we call post-traumatic growth, where there's this kind of positive transformation or a kind of meaning-making process that goes on as a result of this kind of grappling with adversity. And I think that will be true for quite a number of people. And in fact, we don't want to undermine that. Sometimes when we rush in to help, actually this kind of intervention can interrupt the kind of natural coping and resilient processes that people have within them. Having said all of that, I think it's very important to recognize that people are different. And I've heard, and you've probably heard this kind of phrase that's going around that, we're all facing the same storm, but we're not in the same boat. And I think that is really, really important to remember. People are coming at this from very different situations. And like I said, somebody who's living already in a very unsafe, kind of fragile setup, perhaps they're exposed to difficult things at home, perhaps they don't have any support from home, they may have lost their jobs, they may have had COVID, they may have lost somebody from COVID, they might be on the front line and not want to be but feel they have no choice. These are all things that for those people will make it very difficult to get through this time. And I think that as time goes on, what we're going to see is a kind of divergence between these different groups, between people who are basically okay. They might be bored and frustrated and stressed, but they are basically okay, and they emerge from this relatively unscathed with all their both psychological and social and in fact their material resources basically intact. Mm-hmm. And another group who had to deal with extremely difficult, challenging experiences and may well come out of this the other side with less than they had to start with. And I mean that both, again, materially and psychologically. And for those people, it's really important that we don't leave them behind and we don't get swept up in the kind of, resilient discourse that leaves them behind. But on the other hand, we don't kind of assume that everybody is going to be traumatized and that everyone's going to need mental health support, because that is, we know from previous studies, it's just not going to be the case.
Thanks. That's also really interesting. And I guess again, taking a step back, it's really interesting from a social determinants of health kind of perspective as well. I guess, we already see kind of socially this divergence, and it seems from what you're saying that this might have long-term effects on people's mental health. And so this might kind of entrench already existing inequalities perhaps. So that's something to be really worried about, I suppose.
Yeah, and that's things that we see anyway on a day, even aside from COVID, we know that mental health problems are not experienced equally across all levels of society. Everyone is vulnerable to mental health problems, but that things like your social and economic resources have a huge impact in increasing or contributing to or conversely buffering or protecting against mental health problems. You can't really divide these things one from the other. So I think that we're just seeing an exacerbation of something that is already kind of systemic.
How can we basically look after our own mental health in the current crisis? What would you advise people that are watching this video to do?
So I think, like I said, first of all, there are some kind of big things that maybe people can't do as individuals for themselves, but that require real changes. But I think on the individual level, there are things that people can do to take care of themselves. And the first thing I'd really emphasize is a kind of self-care focus. And by self-care, I mean, we're going to be in this for the long haul. This isn't going away anytime soon. And so people need to pace themselves and kind of get ready for this long period of COVID that we have to learn to live with it and cope with it. So, first of all, take breaks from the media, take breaks from, from your Facebook and other kinds of, social media and the news. Try and connect with people that you love, family, friends. And again, when we're talking about connecting, I'm not talking about meeting, I'm talking about phone calls and Zooms and emails and other ways that we can be in touch with people that still keep people safe. If you have people who you live with in your household, then take time out from work and other kind of, other things that might be demanding time of you, like the housework or anything else, and just spend quality time together. Things like eating and drinking properly and trying to have good sleep schedules, trying to maintain a routine, going out, fresh air and exercise is good for both physical and mental health. And I think that it's also important to know that when you feel that you're not coping, and everyone will have times like this, that it's normal to have times where you feel a bit worse, that there is help available. There's help, from people that you love and that want to support you. And there's also more professional support if you feel that's something you need. And there are various helplines that have been set up. And I know that across the UK, there are also local sources of support. Various trusts and local councils have set up various helplines and other kind of support services as well. So I think that it's important that if people feel that they are not coping that well anymore, that they reach out to ask for help, because actually that help really can make a difference.